Are you taking your blood pressure medication in the morning? If you are, I need you to stop what you are doing right now and watch this entire video, because what I am about to share with you goes against everything most doctors tell their patients. It goes against the advice printed on most medication bottles, and it goes against the habit that millions of seniors over 60 have followed faithfully for years. And it may be the reason your blood pressure is still not under control. I want to tell you about a patient named David. David was 72 years old, retired firefighter, strong man, disciplined. He took his blood pressure medication every single morning at 7 a.m. without fail. He set an alarm. He never missed a dose, not once in 4 years. And yet every time he came to see me, his blood pressure was still reading 155/92. We checked his diet, we checked his sodium intake, we checked his stress levels, we checked everything. Nothing explained why his numbers refused to come down. Then one evening, David called my office in a panic. He had accidentally taken his medication at 8 p.m. instead of his usual morning time. He had forgotten that morning and realized it late at night. He called me worried he had made a dangerous mistake. I told him not to worry, just monitor his readings. He called back the next morning. His blood pressure reading was 118/74 for the first time in 4 years. One change, one evening dose, numbers he had never seen in 4 years of faithful morning medication. David was not broken. His medication was not wrong. His dose was not insufficient. The timing was wrong every single morning for 4 years. Stay with me for the next 15 minutes, because what I am going to teach you today is one of the most important and most ignored pieces of cardiovascular medicine that affects millions of seniors right now. This is not about changing your medication. This is not about adding supplements. This is about one simple shift in timing that your cardiologist probably never explained. And if you stay until the end, I am going to give you the exact words to say to your doctor at your next appointment. Words that could change your cardiovascular health completely. So do not leave early. Your blood pressure does not stay the same all day long. Most people think it does. Most people imagine their blood pressure as one fixed number, like their shoe size. That is completely wrong. Your blood pressure follows a 24-hour pattern. It rises and falls throughout the day and night in a rhythm connected to your body clock. During the night while you sleep, your blood pressure naturally drops by 10 to 20%. This is called nighttime dipping. And this dipping is essential for your cardiovascular health. It gives your heart and blood vessels a rest. It allows your arterial walls to recover. Then starting around 4 a.m., your blood pressure begins to rise rapidly. By the time you wake up between 6 and 10 a.m., it has surged significantly. This morning surge is the most dangerous window for cardiovascular events. The majority of heart attacks happen during this window. The majority of strokes happen during this window. Not in the afternoon, not at night. In the morning, during the exact hours when most seniors are taking their blood pressure medication. Here is the problem. Most blood pressure medications are prescribed to be taken in the morning. You swallow your pill at 7 a.m., the medication enters your system, it begins working, it peaks a few hours later. By evening, by the time you go to bed, the medication has worn down significantly. Its protective effect is at its lowest, and your blood pressure, which is supposed to dip at night, does not dip properly because the medication is no longer fully active. Then the morning surge comes, and your medication from yesterday morning is nearly gone. The new dose you take at 7 a.m. has not yet kicked in. There is a gap, a dangerous, unprotected gap, every single morning, right during the highest risk window for heart attacks and strokes. This is exactly what was happening to David. Every morning between 4 a.m. and 7 a.m. His blood pressure was surging without adequate medication coverage. He was always slightly behind, always chasing the problem instead of preventing it. Are you starting to understand why this matters so much? Now, why does your doctor still tell you to take it in the morning? This is a fair question, and I want to give you a completely honest answer. Morning dosing was the original standard when most blood pressure medications were first developed. The research at that time focused on daytime blood pressure control. Nighttime readings were not studied carefully. Morning dosing is also easier to remember. Doctors know that the best medication schedule is the one a patient actually follows. Tying medication to breakfast makes adherence easier. But here is what the research found. The landmark Hygia chronotherapy trial, involving nearly 19,000 patients, found that patients who took their blood pressure medication at bedtime, compared to those who took it in the morning, had significantly better nighttime blood pressure control. They had better nighttime dipping, and they had dramatically lower rates of heart attack, stroke, heart failure, and cardiovascular death. Not slightly lower, dramatically lower. The bedtime group had nearly half the risk of major cardiovascular events compared to the morning group, nearly half the risk, from one change: the time of day they swallowed their pill. Write this down. This is critical. The goal of blood pressure medication is not just to lower your numbers during the day when you are awake. The real goal is to protect your heart during sleep, when your arteries are supposed to be recovering, and to blunt the dangerous morning surge. Evening medication does both of those things. Morning medication often does neither efficiently. Now, I want to address the concern I know most of you have right now. You are thinking, I have been taking my medication in the morning for years. If evening timing is so much better, why have I not had a heart attack already? Your medication, even taken in the morning, is providing some protection. It is lowering your overall blood pressure. It is reducing risk compared to taking no medication at all. But the question is not whether morning medication helps. The question is whether it is providing optimal protection during the highest risk window. For most seniors over 60, the honest answer is no, it is not. Think of it this way. Imagine you are trying to protect your house from a fire that reliably starts between 4 and 8 a.m. every morning. You could station your protection during the day, when fires almost never start, or you could station it overnight, so it is fully active right when the fire actually starts. Morning medication is like stationing your protection during the day. Evening medication is like stationing it overnight, exactly when it is needed most. Now let me address another critical concern. What if taking medication at night makes my blood pressure too low while I sleep? What if I feel dizzy when I get up in the morning? This is a legitimate concern, and it is one of the reasons you should never make this change without talking to your doctor first. For most patients, bedtime dosing of standard blood pressure medications does not cause dangerous drops in nighttime blood pressure. The medications work gently over many hours. However, for certain patients, including those on multiple blood pressure medications, those who already have low blood pressure, and those with certain kidney conditions, bedtime dosing requires careful monitoring. This is not a change you make on your own. This is a change you bring to your doctor. I will give you the exact words to say in just a few minutes. Now I want to talk about something most cardiologists know but rarely explain. It is called non-dipping. In healthy people, blood pressure drops 10 to 20% during sleep. This is normal and protective. But in many seniors over 60, especially those with hypertension, this nighttime dipping does not happen properly. Their blood pressure stays elevated all night long. It never gives the heart and blood vessels that essential nighttime rest. Non-dipping is strongly associated with increased risk of heart disease, stroke, kidney damage, and cognitive decline. And most doctors only measure blood pressure during office visits, during the day. They have no idea what that patient's blood pressure does at night. They are treating the daytime number and completely missing the nighttime problem. I had a patient, 68 years old, named Carol, 7 years on morning blood pressure medication. Daytime readings were reasonable, but she kept having bad mornings, headaches, dizziness, a feeling of pressure when she first woke up. Her daytime office readings were fine, so nothing changed for 7 years. Then I ordered a 24-hour blood pressure monitor. The daytime readings were normal, but the nighttime readings, between midnight and 7 a.m., were alarmingly high. Her blood pressure never dipped. It stayed at 158/94 all night long. And in the morning, right before her medication, it spiked to 172/98. We switched her to evening dosing. Same medication, same dose, different time. 3 weeks later, her 24-hour monitor showed proper nighttime dipping. Morning surge significantly reduced. Carol was waking up without headaches for the first time in years. same medication, same dose, different time. Now let me give you what I promised, the exact words to use with your doctor. Say this at your next appointment. Doctor, I recently learned about research showing that bedtime blood pressure medication may provide better nighttime and morning surge protection for some patients. I know about the Hygia chronotherapy trial. I have been experiencing some morning symptoms. Can we discuss whether switching to bedtime dosing might be appropriate for me? Write those words down. Take them to your appointment. Your doctor may say yes, let us try it. Your doctor may say your specific medication works better in the morning. Your doctor may want to do a 24-hour monitor first. All of those responses mean your doctor is taking the question seriously. What you want to avoid is leaving an appointment without asking the question at all. Here is the practical protocol for those whose doctors approve an evening timing change. Choose 8 p.m. as your consistent evening time. It is late enough that the medication peaks during the early morning danger window. It is early enough that you will not forget. Take it at the same time every evening. Consistency matters more than the exact time. Do not take your evening medication right before vigorous exercise. Wait at least 30 minutes. If you wake in the night feeling dizzy, sit on the edge of the bed for a full minute before standing. This prevents falls. In the first 2 weeks, measure your blood pressure both morning and evening and keep a written record. Bring that record to your next appointment. If you miss an evening dose, do not double up in the morning. Take your regular dose the following evening. If you are on multiple blood pressure medications, do not make timing changes without a specific conversation about each individual medication. ACE inhibitors, ARBs, beta blockers, calcium channel blockers, and diuretics all have different timing profiles. Your doctor needs to guide this. And for those who have already had a heart attack or stroke, this conversation with your doctor is even more urgent. Post-cardiac patients have the highest risk of a second event during the morning surge. You deserve the most optimized protection possible. David has been on evening dosing for 2 years now. His consistent reading is 116/72. He told me at his last appointment, I feel better in the mornings than I have in 10 years. Clear-headed, no pressure, no heaviness, same medication. Same dose, different time. I am not promising everyone will see what David saw. Every person is different. Every medication is different. But I am telling you that the question of when to take your blood pressure medication is one of the most important questions a senior over 60 can ask their doctor, and most seniors never ask it. You now have the knowledge. You have the research. You have the words. Use them. If this video helped you today, please share it with someone you care about who takes blood pressure medication, because this information at the right time saves lives. Subscribe to Golden Healthy Years for honest health information made specifically for people over 60. Take care of your heart, take care of your mornings, and take care of yourself.